We have a very strong emergency response team in place. We're part of the EOC as well nationally, and we have been preparing and we know how to respond, and we try to mitigate prior to things like this happening. But we do know that with climate change, with the effects of global warming, storms and severity of storms will get worse, and for that reason we prepare as best as possible. Just before the hurricane season, we have our multi-hazard plan in place at all health facilities. I know that they have opened up some places that people can go in order if the homes have been flooded, and those areas are usually manned by somebody from the Ministry of Health as well, where we take in pharmaceuticals, we give educational talks as well. And with COVID, we've got to ensure that there is the spacing, there is the mask mandate in place. If anybody is ill, we try to pull them out as early as possible. When it comes to the vector-borne illnesses, Belize, we have been doing quite well, especially with malaria. Compared to many other countries. As you may know, we have recorded 3 full years of having 0 cases locally, and we're in the process at this point to get a formal assessment from WHO to be declared malaria-free. When it comes to dengue, definitely this is something that we are monitoring. We've got to ensure that we, as best as possible, do a lot of education with the prevention. We still are doing the residual spraying, the larvicidin, everything that's needed, and that will be increased right now with the flooding as well. Just to remind the general public, as best as possible, to keep your yards as remove any kind of debris, dirt, anything that holds water,